computer. Hi, welcome to another Wellness Wednesday. My name is Aurelia Byrne, and today I'm extremely excited to have one of my favorite people. I think everyone's my favorite people sometimes, but Dr. C, I love you so much. This is Shahan Chowdhury. She is known as Dr. C. She's a board certified family medicine physician. Dr. C and I go back many years now. It just seems like yesterday when I met you, but we met at a dental office because I'm a dental hygienist, and we met at Dr. Wade's practice in Texas, Stonebriar Smile Design, where I practice full wellness dentistry. And Dr. C, we basically share patients. We manage patients together. So, hygiene with patients would come into the hygiene room, and we would do, Dr. Wade's systematic approach to wellness and go through all the systems of the body and find out people's root cause of their illness, and then send them over to Dr. C with some information gathered by their oral health. And then you and Dr. Wade would collaborate and get these people in tip-top shape. We would clean them up, stop the inflammation in their mouth. And there's so much to that, but we'll do that on many more episodes down the road. And Dr. C, thank you for being here. You're truly an amazing physician. I can't say enough about you. And I just, from the bottom of my heart, you're an amazing woman.
Well, back at you. You are too. Very innovative. And you have given me lots of ideas and lots of things to collaborate together with in the future, in the countries, all of that.
Yes.
But I really wanted to thank you for having me on board. A little bit about myself. So I was born in England, and I never wanted to be a physician. Thought it was too difficult, too long, what everyone thinks. But then when I moved here with my husband, I got to work with a genetic counselor who was also a and I realized then that with my genetics background and my love of just getting to know people and be with people, I was able to find out so much, and I found it fascinating. And so I said, okay, let's give it a try. Well, 20 years later, here I am.
Yeah.
But, as people grow, learn, become wise and mature, I started realizing that I was very passionate about how to prevent heart attacks and strokes, one person at a time. Mm-hmm. The reason why is because I actually come from a family with a very strong predisposition for diabetes. Some of you who are listening might be able to relate. My father, non-smoker, secondhand smoker, I would guess, teetotaler, entrepreneur in England, he basically had a physical and he did a treadmill stress test. He passed it. And then a couple of weeks later, he was traveling to actually LA, and he had a heart attack. So at that point, it was like, well, he's been cleared. Why did he? What I've learned over the years is that people can present in normal ways, normal blood pressure, normal cholesterol, and still have a heart attack. Yeah. So I've devoted my time and my life to basically finding out why. And I think you, me, Dr. Wade, we subscribe to this holistic way of addressing health. We do follow a called Bale Doneen, which systematically helps us understand what's going on. And now this is what I do day in, day out. I love to find out about people's backgrounds, histories, and avoid all these things. Something, Aurelia, you don't know, is that in the last 2 months, it has been hit home very hard that the oral systemic connection is, I know it's real, but it's very prevalent in my family.
Oh.
So when my father, looking back, my father had pretty bad periodontitis. And I believe that could have been the inflammatory trigger pulling event that caused his heart attack.
Mhm.
I'm not sure if you were here when my mom was here, but he did get a cone beam CT. Some
Yeah, I
of
remember
our very good dentists do, and they found subclinical abscesses
Yeah.
beneath the teeth. And my mom being her, instead of following what Dr. Wade said, which was take out 3 teeth, she says, oh no, I'm going back to England. And then she only took out 1.
Yeah.
But a year later, being a postmenopausal woman with the holy trifecta of diabetes, high blood pressure, cholesterol, she experienced sudden onset of fatigue. She couldn't walk up the stairs. And this is a very active woman. Because I know her history and I've done the workup, I told her to go to the pathologist, and that's when we found her LAD was completely blocked and she had to have a stent.
Mm-hmm.
But something that's more shocking is that last month, my 49-year-old brother had 2 heart attacks, open heart surgery.
No.
Horrible. I mean, he has pretty significant periodontitis, but he never made it to come see me and let me do the testing or go see Dr. Wade. So that's something you don't know. But if ever there was a reason to take care of your mouth, that would be it.
I know. I talk to a lot of people, just, if I'm, meeting people and I'm like, oh, what do you do? Well, I'm a dental hygienist, and, well, now I have, do other things as well. But, I always say I'm a dental hygienist, a registered dental hygienist. And then, everyone immediately wants to talk about the mouth, which is great. And it's so hard for me because of the knowledge of inflammation in the mouth, hidden dental infections, oral DNA, just the whole thing. And I just looking at them and I can see like, oh man, I just would love to get in there. You look at your inflammation, find out what's going on there in your and what's going on in your gum tissue or your teeth in general, to help you move along. And it's hard to find.
It's hard to simplify that because it's such a loaded situation,
For
same
sure.
thing.
Yeah.
I'm sure. Oh, well, let me tell you about this, but it's like, yeah, there's so much more. I could sit here for an hour and talk to you. But yeah.
I mean, I'm like, Dr. Wait, or Dr. C, I'm so stressed out, my cortisol levels. What do I do? Oh, you got to test all your hormones. It's not just that. We got to look it up. I'm like, oh my God. It's just so much. And that's the thing, like, when I decided to do Wellness Wednesdays, it was in honor of what inspired by what we do at Stonebriar, and we did Wellness Wednesdays there. And just for our staff, I shouldn't even say staff, our team members and such. And I just wanted to give pieces of information to people, not just in the dental community, and that's where I'm at, but my grandmother is watching, my aunt is watching, my cousins may be watching, their friends that are not in the medical industry, that are not in the dental industry. And I have so many amazing connections like yourself that can educate people on just a little bit to be they're patient advocates, right, Dr. C? And
education is power. And I think over the years, you and I have picked up pearls of wisdom that need to be imparted and shared with others. Yeah. Because I know it sounds so fatalistic to talk about all these issues, but I want people to understand that whatever we find, on the whole, you and I can do something about it if we work. And I think the first thing is just bring it to people's attention, bring it to everybody's attention, just to be aware. And then eventually, a lot more can be done about it. But I'm sorry to say, the way our medical system is right now, every patient has to be their own advocate. Because it would be nice to say that, physicians, nurses, mid-levels, all of them they have oodles of time to sit and chat with you and, you know, help you with these problems, that problems. I mean, just to even deal with insurance takes somewhat of a brain and also time and a sense of calmness to overcome all the frustrations that are put in people's ways. It's not the same insurance we had 10 years ago.
Yeah.
So be a little insurance savvy and educated. But
yeah,
nonetheless, I think we're in a great, amazing time in medicine because there is so much research going on about, oh my gosh, everything, mental health, emotional health, physical health. There is a term called biohacking, which maybe some of you know, and that's where you find an easier, less complicated, and more satisfying way of achieving certain results. For example, I learned that women have poor bone health as they age, primarily because our activity goes down, our hormones are running out. So we're kind of left with the potential for weakening bones. Treatment on the whole is through some very good medications, but you know, every medication has their pros and cons. But the biohack related to osteopenia, which is weaker bones, and osteoporosis, bones, low calcium in them, there is something called OsteoStrong, which in a way is a commercial franchise, but the science is based on loading the body with weight for only so many seconds once a week. So you can go through a whole series of exercise over 10 minutes, and over the weeks, you will see your bones are getting stronger.
interesting.
That the ligaments and tendons attached to the bone is more secure for the muscle to also be more robust. And so what do we worry about when we get older? We worry about falls and fractures, stuff like that.
Yes.
So this is a great way to do something like that without a side effect of medication. That's an example of a biohack. So it's a great time to be here and to have the freedom of just looking at these things. And so maybe as we go through some of our conversations over the weeks, maybe we can mention a biohack here and there.
Absolutely. I would love to hear more about that. I mean, of course. I mean, I was just thinking right now, you know, if you're someone, you know, we're not young, but we're not old either, you know.
Well, I mean, right, you are too, you know that.
So what if someone like in their 60s or 70s did a biohack, just like you said, with putting, you know, loaded on your, you know, weight, not probably lifting weights, but just some kind of.
Yes.
Yeah. Mm-hmm. How, I mean, do you think that would affect them? Would that help them? Or would that be just too much for them at the age that they are? And I guess it depends on lots of variables, right?
So I would never suggest a biohack without understanding that person. I would have to see what is your medical history, what's your past history, what's your family, what testing, preventative guideline testing have you done already? Mm-hmm. But it's never too late for anyone to start moving, right?
That's right. So
these things are very safe. They're monitored. You never go in there on your own. And there's ways to start off wherever you are and improve from that. The benefit is a sense of accomplishment. You have mini social engagement staff at the area, at the facility, and you can see it feeds back to you what your gradual progression is.
Oh, great.
And, so it's very objective and subjective. I mean, it's only 10, 15 minutes, but you feel like I just did something there, you know?
Yeah.
Huh. So there's a accomplishment. And the bottom thing is it gives you confidence. You feel better about yourself, well-being, get stronger. So if you were to trip on a curb, you could prevent yourself from falling because your bones are stronger, you are more agile, and maybe save yourself from having that hip fracture or something that really is the beginning of the end for many older patients.
Yeah. So I have some questions about, and I'm only doing this selfishly. I'm sorry, Dr. C. Selfishly for somebody else. So I have some family members that suffer with rheumatoid arthritis, and I don't know, I know their dental history, so I know that, there's no teeth involved. So, the first thing I think of is inflammation in the mouth. Let's control the inflammation, because arthritis is an inflammatory disease. We know this, it's just one of those things. But if there is no inflammation in the mouth, could it be coming from the gut, or could it be how do you find out, or what would you recommend? Like, as you, a physician, how would you handle that situation?
Great question. So what is inflammation? Where does it come from? Well, inflammation can come from anywhere from the tip of your toes to the top of your head. So what does that mean? Inflammation can come from depression, anxiety, PTSD, chronic sleep deprivation. It can come from gum inflammation. It can come from a sinus infection. It could come from high blood pressure, smoking, drinking too much, stressing too much. It could come from any kind of bacterial, viral, fungal infection. I mean, let's go on and on and on. So bottom line is, if you can imagine, visualize a very tall oak tree. The tree trunk is very solid, but it's on fire. And if that fire continues to burn, it's going to burn all the rest of the tree right down to the twigs and the leaves. Imagine that's an event, a heart attack or stroke. Mm-hmm. So wouldn't you want to just get some water and put that fire out? But the problem is that fire, if you look at what's causing that fire, is basically all those roots underneath the soil has a contribution to that fire. Yeah. So you correctly said rheumatoid arthritis is a form of inflammation in the body. And one of the root causes is oral, whether it's endodontic or what was the other one? Endodontic and
periodontic. Yeah.
You've already looked at that, treated that. There's no inflammation from that. So then the next thing is, well, where else could it be? Yeah. And that's why you do a full review of systems. What's your energy level like? What is happening in your head, eyes, ears, nose, your heart, your lungs, digestive system, and so on and so on. As you brought up the gut, this is the way I look at it. You have, we all know that we have GI doctors or gastroenterologists that look at the tube, the colon.
Yeah.
Right? But what's in the colon? And that's the poop. Well, do we realize that in that poop, so far, we know there are billions of bacteria in there, but there's roughly, for my treatment purposes, there's roughly 7 large groups of healthy bacteria. Mm-hmm. And those bacteria are known as probiotics. They're there to help us. You've heard of prebiotics, right?
Yeah.
Prebiotics are essentially the food containing fiber that we eat, we digest, the bacteria sees that, ferments it, uses it up, and it enables them to populate and also produce other metabolites. Those metabolites are used to keep us healthy. So think about prebiotics, probiotics, and then postbiotics is the metabolites.
Yeah.
So what would happen if you had an imbalance of those 7 healthy groups of bacteria? Something goes off. Could it be inflammation? Like you're not exactly allergic to a food, but you're sensitive to it. But you may not because you aren't having a reaction. Or you're eating processed foods, which is creating more inflammation in the gut. Mm-hmm. So that's a very long answer to say what could we look at, but that's why it takes a while to figure out, but there's always something positive that you the patient and I, the physician, can do something about. So don't ever lose hope that, oh gosh, I've got this and whatever, but there's always a way to help yourself.
And thank you for that really amazing explanation, because not only, like, somebody could be watching this right now that has rheumatoid arthritis and they never even been told that before, like, at all. Now, my family member, of course, they have, because I'm in the ear, but you know, I understand that, and I know that, and I'm very, I strongly believe that you can get down to the root cause of a problem and stop it, because I've done that with Dr. Wade and you hundreds of times, or you know, it's amazing what we've done and together as a team when I was working as a dental hygienist at you know, Stonebriar Smile Design. So I understand that, and this is why I wanted to do Wellness Wednesdays, because you know, education is powerful, and just that explanation could inspire someone else to seek out a physician like yourself, or just be their own patient advocate, because now they heard something.
Yeah. So two things that come out from that is, I would ask all your viewers to always ask why. Why am I being put on this medicine? Is it a Band-Aid to take care of the symptom, or am I actually addressing the root cause? Do you keep bailing out water out of the ship, or do you look for that hole, plug it up so that you don't have to, you know, keep bailing? So always ask why. The other challenge that I think some of your viewers might have is that traditional, what I call insurance-based medicine, not everybody has been educated in that way. And frankly, I wasn't educated that way. But as I developed my practice, and really a curiosity because of my passion of preventing heart attacks and stroke, one person at a time, I learned these things. And then I saw, yes, this makes sense, because everybody's a little different. So you might find a challenge to find the right doctor, but there is a new science out there, a discipline of medicine called functional medicine. Mm-hmm. I encourage you to look for a physician that's in your. Now, granted, insurance may not always cover this, but if you have, health savings account, flexible spending account, something like that, so long as it's medical related, there is a way to seek that kind of counsel using those kind of funds. But I will tell you, not everybody thinks like you, and everybody thinks like me. So if you go to your GI doctor, what's my gut microbiome? I don't know if they would be very much, but it may be a matter of time before they.
Yeah, and in our industry, in the dental industry, we, you know, I know that it's been, microbiome is been used widely. Like it's a thing for us, because we, you know, we're that's the first part of digestion is the mouth, right? So gut health is in nutrition. You know, even in hygiene school, we have to learn nutrition. Well, why is that? Well, because we're treating patients, and the first part of digestion is the mouth. So, I mean, why wouldn't we specialize in the microbiome and gut health and lead our patients to someone like yourself to help them get even further along with maybe a Crohn's disease, which I've had patients with that and before, and it's and again, that's an inflammatory issue as well. And you know, the patients that I've seen that had Crohn's disease and gone through, they had periodontal issues, and they had maybe a hidden dental infection. So, and that is just going to stem up more problems for them with their Crohn's. It's gonna irritate that even more. There's just so much that we can talk about.
So wide, you know,
it is. It's just right there. Yeah.
And so that's why we strive to have a medical team of providers.
Yes.
So very lucky, because I have Dr. Wade and the team here for the oral aspect, but I've also got an optometrist also in my team that looks at brain, the eyes, and understands how information ties into all of that. So you need, me as a physician, I need peers that can understand the way I'm talking. Otherwise, it's very hard to implement things. But it's relatively new. Strongly, it will be part of medicine down the road, but when that will be, I don't know.
Yeah.
But there are mavericks like us that believe so strongly in it that that's what we do. That's what we need to practice medicine that way.
Yeah. Yeah. Yay! You're my favorite. I miss working with you, honestly. I do. I miss that part of my life in the wellness.
Yeah.
And it's just so hard to find a practice that has that. And I, you know, if I was to go and treat patients again, it would have to be in, you know, a practice that's integrated, like everything, you know, full spectrum. So Dr. C, thank you so much.
Thank you.
I think, you know, next week I have somebody coming on, but let's do the next week. And so we're going to get you on as much as possible because there's so much to talk about. We haven't even talked about genetic testing, all the testing that you can do to find out, you know, what medications you need to take for what, you know, there's so much to discuss and little tidbits. And so I value your information.
Thank you so much for asking me. And as I said earlier, if you'll listen, I'll talk and talk and talk.
Well, I love listening to you talk because of that accent of yours.
Well, thank you for having me.
All right. Well, thank you so much. Bye, guys. Thanks for watching.